Good morning, Mariah.
Good morning.
Are we still in 2020, Mariah?
Unfortunately, yes.
Yes, we are.
It's almost over.
But, I want to thank you guys, all that you've been doing, the information you guys been giving us, the encouragement to our community as we are in this significant time as the COVID-19 virus. There's a lot of questions and a lot of unanswered questions, and some of those only you guys can answer. So we have this first one, Mariah, from Raymond, and he says, how many patients are currently at Maui Memorial Medical Center that are positive for COVID?
Well, as of the last report last evening, there are zero COVID patients at Maui Memorial Medical Center.
So that's been a couple days now we've had that number or lack of number.
We have, yeah. We've seen a decrease.
A lot of people, just to, like the mayor always say, the number's good. That doesn't mean we let our guard down.
Right.
So, question by Noe says, has visits to the hospital or the ER gone up or down during the COVID pandemic in general?
Well, as the only acute care hospital in Maui, our hospital and ER have always been busy. But what we noticed, especially during the first COVID surge in April and May, was that our ER traffic fell considerably for non-COVID related patients. And that was almost by 50%. So we believe many people were hesitant to visit the ER, and some may have felt that their health concern was minor compared to those patients who may have needed COVID care. So they just chose not to visit the ER. But that being said, we know that urgent medical issues like heart attacks and strokes and trauma injuries, they don't just go away because we're in the middle of a pandemic. So we actually saw people ignoring or minimizing signs of illness and not seeking care. And we saw people who were experiencing stroke symptoms for a few days before coming in. And as a stroke program director at Maui Health, I want to emphasize this. Please do not put off any medical care when experiencing any signs of stroke or heart attack. You want to seek medical care immediately. Even during the COVID pandemic, our hospital still is the safest place to be when experiencing a medical emergency.
Which leads us right into this next question by Elaine. She says she lives 5 minutes away from the hospital. Is it better to call 911 for an ambulance or just drive yourself or have someone drive you to the hospital if you think you're having a stroke?
Yeah, I'm so glad someone asked this because a lot of people think that when they need to get to the hospital, they can get there faster by driving themselves. And some people want to save money by not calling 911, but I'm here to tell you that by calling 911, you're saving minutes of valuable life-saving time once you get to the hospital. We work really closely with AMR and our EMS folks, and our paramedics are trained when they get on the scene to know how to assess somebody and see if they are having a stroke. And if they think that they are, they're going to call ahead and let our doc and our nurses know to meet them at the back door so that they can assess them right when they get to the hospital, and they're going to take them right back to the CT imaging suite and get a picture of the brain and see what's going on in there. And this really, really can be life-saving when it comes to a stroke.
I remember when I was young, I had an uncle who actually had a stroke, and my auntie was at work, so he drove himself to the hospital. Thank God that he was okay. Well, my auntie was mad. She was angry. So, men, please don't do it, okay? on the request of your wives.
Not a good idea.
Yes, exactly. Take it from Mariah. She knows. All right. Max says, my daughter learned be fast in school. You might want to help me with this. When I was in school back in the day, it was fast. What is the difference and which is correct? And what are they talking about, Mariah?
These are acronyms for the signs and symptoms of stroke.
Got it.
And both are correct, but we kind of extend on that at the hospital and a lot of hospitals, and we use B fast. So B is for balance, E is for eyes, F is for face, A is for arm weakness, S is for speech, and T is for time. And so we kind of all know, when you think of a stroke, you think of the facial droopiness and the arm weakness, that one-sided weakness, and the slurred speech, right? So, but what we also may not really think of or know is that B for balance, people can be really off balance or feel really dizzy, and then E for eyes, that you can lose vision or have blurry vision during a stroke. So we want people to know those signs and symptoms as well. And what you need to be aware of is that these symptoms can be very mild or obviously noticeable. So it doesn't really matter if the signs are severe or not. If they happen suddenly, it's important that you get to the ER as soon as possible. You really don't want to wait to see if they go away on their own, because this could cost you precious time where treatment could be given. There's a very specific amount of time where we can give treatment. So I want to say this again because it's so important to save a life. We're all concerned about being exposed to someone with COVID-19, and we want to make sure this doesn't discourage anyone from coming to the ER if they think someone they know is having a stroke. We still have our screening tent outside in the ER. We're doing universal testing for all admitted patients for COVID. And if they remain in the hospital, they're going to be tested again on day 3 and day 6. We have universal masking and appropriate PPE for all of our employees. We're screening all employees and providers at the door, and we have limited visitors. We have mass testing of all employees and ongoing testing for employees in any high-risk units and enhanced cleaning protocols. And, of course, you can still go to mauihealth.org/safe to check this out and see and learn more about how we're keeping the ER and the hospital safe.
Awesome. And thank you so much for the explanation. So it's balance, eyes, face, then arm, speech, and then T.
And then time to call 911.
Time. Got it. Thank you so much for that one. Mariah, thank you so much for your call. And thank you, everyone up there at Maui Health, for all that you've been doing. Some awesome information this morning. Any last words, Mariah, before we're done?
No, thank you so much for giving us this opportunity to teach people about stroke and keep our community informed. I really appreciate it.
Awesome. Have a wonderful day, Mariah. We'll talk again.
Thank you.
Aloha.
Aloha.